The battle against the coronavirus is a global fight. This is not a virus that knows any boundary. This is where the entire world comes together as one to fight this invisible enemy. And what we've been trying to do on India Today is to bring you some of the global practitioners who are at the forefront of this fight. We've had Ian Lipkin on our show this week. I am delighted and privileged to introduce to you Dr. Richard Horton. He is the editor-in-chief of the world-renowned medical journal Lancet. It is Lancet's seal of authenticity, which really gives a sense of credibility to a medical research paper. And there are so many theories we've been hearing. Some of them are researched thoroughly and are deep science. Some of it is just completely bogus. And what I hope over the next half hour Professor Horton can do is to help separate real science from what is straight out of WhatsApp University. So I first want to show you the work that Professor Horton and his team at the Lancet Journal are doing, some of the new research papers they've come up with, and I'm sure you have a lot of questions in your mind as well about all the new studies that are coming out from world over and which of those studies carry some meaning and some real purpose. So we'll talk to Professor Horton in just a moment. Take a look at this report.
The world listens to The Lancet, the most respected medical journal on earth with a reputation for documenting the history of medicine. And in the COVID-19 pandemic, it is The Lancet that millions are turning to for sense. Richard Horton is the editor-in-chief of Lancet. The world's most cutting-edge, deeply researched medical studies end up on his desk. If a new medical finding has Lancet's seal of approval, it attains almost instant authenticity. In the wake of the coronavirus outbreak, he and his team have been at the forefront of the fight against COVID-19, publishing research on the new virus and the ways to tackle it. Called the coronavirus prophet, Horton is the most formidable voices on the contagion. He has called the global response to COVID-19 outbreak the greatest science policy failure in a generation, saying that warnings of doctors and scientists were ignored with fatal results.
The standard public health approach to an epidemic is you, yes, test, you isolate, you quarantine, you contact trace, you chase down every single contact and test that person too to see if you can stop the lines of transmission. And that's the way you stop the outbreak.
He's also been a very vocal critic of UK's handling of the pandemic.
We knew in the last week of January that this was coming. The message from China was absolutely clear. And then we wasted February when we could have acted.
Richard Horton also describes Donald Trump's move to end WHO funding a crime against humanity. He's a council member of both the United Kingdom's Academy of Medical Sciences and the University of Birmingham and is a senior associate of the UK health policy think tank, the Nuffield Trust. The world now is keenly listening to every word of this leading doctor. Bureau Report, India Today.
Editor-in-chief of the Lancet Medical Journal, Richard Horton, welcome to India Today. I want to start by asking you about your view on the global fight against the coronavirus at this moment. Do you think we are nearing the peak? Are we around the peak, or is there much worse still to come?
Well, thank you very much for having me. The situation for the pandemic is different in different parts of the world. But if I had to give an overall judgment of the situation, I would say we are still in a position of extreme danger. Although the epidemic has receded from Wuhan and Chinese people are returning to a normal life, in the United Kingdom, we're very much at the peak of the epidemic, as we are seeing in some other parts of Europe. And if we look around the rest of the world, we don't know what's going to happen in Latin America or sub-Saharan Africa. And of course, in India, you are also fighting against this invisible enemy, as you rightly call it. And we need to be extremely vigilant and consider it with great respect.
What do you make of all the research papers that are landing on your desk as editor-in-chief of the Lancet Medical Journal? What research into the coronavirus do you think holds the greatest promise when it comes to finding a solution or a possible vaccine?
That's a great question. And of course, we're all hoping that a vaccine can be discovered and manufactured and produced very, very quickly. But we're not going to have that vaccine for a considerable time. And so we need something else to get out of the lockdowns that our countries are in. And the only way to get out of the lockdown is that as the peak of the epidemic starts to decline, then what we need to do is to test as many people as possible to keep the reproduction of the virus as low as possible. And if you are tested positive, then you are isolated, and then you do what you're doing in India, this cluster containment approach, where you're identifying an individual, you're contact tracing those who they've been in contact with, and you isolate and quarantine the individuals and those areas. That is the only way that you're going to sustainably exit the lockdown that we are all facing.
Dr. Horton, you just said that it will take a lot of time for the first vaccine to come out. We heard from Professor Adrian Hill at Oxford University, who believes that by September they'll have a vaccine that's cleared all human trials, and by December the vaccine will be in India. As the editor-in-chief of Lancet, do you think there is promise to that claim?
Well, that is the best case scenario that you've just articulated. I will keep my fingers crossed that that is what happens. At the moment in the United Kingdom, there are 2 vaccine candidates that are soon to enter trials. And let us hope that one of those 2 vaccines is successful. But the honest answer is we don't know. And science is a very uncertain kind of discipline, and we may have a vaccine by December, but we may not. And that is why I'm saying that the way we now have changed our lives, physical distancing, wearing masks, working from home, these changes to our lifestyle, they're not suddenly going to go away even when we have a vaccine. I think we are going to see some long-lasting impacts on our society and how we interact with one another.
You said the key right now is test. In India, we imported a lot of rapid body tests from China, as has been the case in several other countries. A lot of those tests didn't give the desired results, and now we put those rapid tests on hold. So if we have to test, what do you make of all these Chinese tests which are misfiring, and then countries are saying we don't want them, and as a result of which we made this effort, we delivered them to all our states, and now we can't use them?
No, you're right. I mean, when we say test, which test? And does the test work? That's exactly right. And I'm afraid we did the same. In the United Kingdom, we bought antibody tests, and I think we spent something like £20 million on them, and they don't work. And now we're going to have to throw them away. The testing that we need to do actually is not the antibody testing, though. The testing is to see whether you actually have virus in you, to see whether you're infected. Not to see whether you've had the infection, that's the antibody test, but to actually see whether you have the infection now. Because if you have the infection now, that's the time when you need to be isolated, and you need to then quickly find your contacts and isolate and quarantine them. So those tests we do have. The challenge there is that for those tests, you do need to have laboratory capacity. And that's going to be the big difficulty for countries. Do they have the laboratory capacity to be able to do the volume of tests that's necessary to make the diagnosis?
One of the problems we have in India, Professor Horton, is with asymptomatic people, and that's the case globally. The Indian Council of Medical Research said 80% of the carriers at this moment aren't showing any symptoms to suggest that they are COVID-19 positive. How do you suggest a country like India deal with that situation?
Yeah, you've put your finger on one of the mysteries and uncertainties of this whole pandemic. And actually, it's great you asked me, because we have not been discussing this enough in the United Kingdom, and it's a really urgent issue. I mean, it's not clear exactly what the proportion of asymptomatics is, and it might be different at different age groups. So, for example, children who we have so far not thought have had serious illness, well, it may be that they haven't had serious illness, but they have got the infection, but they just don't realize they've got it. Now, if that's the case, if we have a large number of asymptomatics amongst children, then it's going to be very challenging there to isolate children, and then we're going to have difficult questions to ask about when we let children go back to school. Because if they go back to school, we need to make sure that they are tested so that they're not passing on infection to each other or to their teachers or to their parents and other family members. So this is a really serious difficulty. What we need to do, I would say there are two particular groups we need to focus on. We need to test children, and we also need to test healthcare workers. It's our healthcare workers who are on the front lines of defending society. And our healthcare workers could be very much exposed to the virus. They could be asymptomatic, and we need to be testing our healthcare workers at least every week to make sure that they don't have the infection.
Many who are watching you at this moment in India today are anxious about children. I have a 4-year-old son. Will he be able to go to school this year, or do you think the whole year is written off? What about college? What about university? The people who are paying big money to send their children to good schools, good colleges, good universities, and now they're wondering, is virtual education even worth it, or should they just drop a year, resume next year? What's your best sense, Professor?
I understand. I have a 19-year-old daughter, and she's had her first year at university terminated early because of her university has closed down. So I absolutely share your anxiety. Look, let's be positive about this. The epidemic in each country isn't going to go on forever. It will burn itself out if we go into lockdown. Our countries are doing the right things to control the outbreak. So as the epidemic declines, in my country, that's going to be the end of May, early June. If the lockdown is successful in India, you could see the decline in the epidemic over around a 10-week time course. If at the end of that 10 weeks or so the epidemic is over, then people are going to be able to begin to resume normal life. Not exactly normal. I think we're still going to have physical distancing. We might have to wear masks in the street. We're certainly going to have to wash our hands more and pay attention to personal hygiene more. But I think in that situation, we are going to see normal life resuming, and with increasing test capacity and quickly isolating people with symptoms, that then I think will mean that we can send our children back to school. But what it will also mean is in school, things are going to have to change. You won't be able to have schools with classrooms where children are sitting next to each other very closely. I think you'll need to have classrooms where children are sitting further away from one another, and we will have to have those physical distancing measures available in schools.
But in a lot of places in countries like India, that's just physically not possible, whether it's the slums or one of our municipal schools, even in big private schools. How do you suddenly create extra capacity so that you have half the number of children you would ordinarily, and especially in places like Dharavi, which is one of the world's biggest slums? There are 8 or 10 people living in one room, one very small room. So how do you implement the idea of physical distancing when that's physically not possible?
I understand. I think in a situation like that, you've got to wait until the epidemic has burnt itself out, as I say, at the end of that 10-week period after lockdown. And then the only other things that you can do are face masks, very careful attention to personal hygiene, hand washing, for example, cough etiquette, making sure that you cough into your shoulder. If you use tissues, then you dispose of those tissues immediately. These are the only things, in the absence of a vaccine, these are the only things that one can do to reduce the risk of contracting the virus. There's nothing else available until we have a vaccine.
Oxford University published a study which said India has the most stringent lockdown in the world. Lockdown 2.0 gets over in a few days from now. What's your view, Professor Horton? How should a country like India assess the question of re-entry? What's our best strategy in your view?
You mean the virus coming back into the country?
No,
yes.
I'm saying once the lockdown gets over towards the first part of May, on the 3rd of May, how should we approach the issue of re-entry? There are enough and more people who are watching you at this time in key positions in government, outside. They're getting restless. They're saying we've been locked up forever. Now we need to get back, start our factories. Life has to resume. We can't be in hiding from this virus forever. What should India's post-lockdown strategy be, Professor?
Right. So first of all, I understand that everybody wants to get back to normal. I understand we want to resume our economic activity, but please, I really urge you, don't rush this, because if you rush going back to work, if you rush lifting the lockdown, and you have a second wave of the infection, then that could be even worse than the first wave. So, and then it's going to cost, you're going to have to go all the way back to the very beginning of your lockdown. So you've invested so much time and effort in your current lockdown. Don't waste that time and effort that you've invested. Keep going with it as much as you possibly can until the end of a 10-week period. And then... So
you're saying the lockdown should be 10 weeks starting from the day that it started?
Absolutely.
Why? Why can't it be a shorter lockdown? We've been locked down for about 40 odd days. Why is that not enough?
It's not enough to control the epidemic. If you look at the evidence from Wuhan locked down in the way that China did its lockdown, in other words, very aggressively, on January the 23rd. On January the 23rd, they locked down, and for 10 weeks until the early part of April, they stayed locked down and they extinguished transmission of the virus. And now they're returning to normal. And all of the epidemiological modeling showed that they needed to stay locked down for around 10 weeks. That's going to be the same in other settings as well, because that's the nature of the virus. The virus spreads. It's an aggressive virus. It will spread rapidly in a population if you don't physically distance. So
but I could counter-argue, I don't understand epidemiology, but just looking at it from the outside, I could counter-argue that when, at the end of the 10-week period, you reopen the country, what stops the virus from spreading then?
Well, then what you've got, the virus then is not spreading because very few people have the infection. The virus will spread rapidly when you have lots of people with the infection interacting with lots more people. If we've all been staying in our homes, we haven't been mixing with people because we've been locked down, then there's no opportunity to spread the infection. So what we'll do at the end of 10 weeks is there'll be a very low level of infection, very low level indeed, and so there's no opportunity for it to spread again if we go back to work and go back to school at a very slow rate, and if we do this testing and contact tracing. That's really, really important. The testing and contact tracing is really, really key to the success after the lockdown.
What's your view on the efficacy of hydroxychloroquine? President Trump seems to be a big aficionado. He's asking the Indian government to provide him with HCQ. There's a new report in the New England Medical Journal which says that HCQ doesn't work. In fact, it could increase the possibility of mortality. What's the Lancet view on the use of HCQ?
The Lancet view, my view anyway, is that there's not one piece of evidence to support its use, and it's highly irresponsible for anybody, particularly a political leader, to suggest otherwise. Indeed, taking a drug that does not have any proof that it works or that it's safe when taken amongst such a large population is highly dangerous. So as a physician myself, I strongly advise against taking this drug until we have reliable evidence.
Professor Richard Horton, I have dozens of more questions for you, as I'm sure most of our viewers do, but I'm out of time on this broadcast. But I want to leave by extracting a promise from you that you'll come back again on India Today and share your thoughts, because this is a constantly evolving situation. So as more research lands up on your desk, you go through how authentic that seems to you. I do hope, Richard Horton, you can come back and share your insights with us. It's been an absolute privilege listening to you. We've had so many people speak, but you've been able to add a level of clarity backed by the most authentic research that you're looking at. Thank you so much, Professor Horton.
Thank you very much. It's a pleasure.
Are you going to come back again?
Of course, anytime.
Brilliant. Thank you so much. I look forward to having you. We're done with the news track tonight. I hope you enjoyed our power-packed broadcast. I look forward to seeing you at 8 p.m. tomorrow evening. Rajdeep Sardesai comes up with News Today on the other side. Stay with us. Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel and don't forget to press the bell icon to stay updated.